And COVID-19 is on the rise across the country. The latest data from the Virginia Department of Health shows nearly 2% of emergency department visits were related to COVID, and 9 people have died from infections since the start of August. Current VDH guidelines say those experiencing COVID symptoms can return to normal activities 24 hours after those symptoms improve and your fever goes away. And if you test positive and have no symptoms, you may be contagious, but you don't have to isolate at all. And in North Carolina, health officials are seeing a similar increase in COVID cases. But with guidelines changing all the time, people are wondering if you could get COVID. If you get COVID, how long do you need to stay home? Megan Bragg at our sister station in Charlotte verifies.
This chart from the North Carolina Department of Health and Human Services shows their COVID-19 wastewater monitoring. COVID-19 continued to rise in August, which is now at moderate activity. Here in Mecklenburg County, COVID-19 cases also continue to rise. So what are the new guidelines if you get the illness? Let's verify.
Our sources, the Centers for Disease Control and Prevention and NCDHHS. The first question, when should you stay home? The CDC recommends staying home if you have symptoms that include fever, chills, fatigue, cough, runny nose, and headache. Next, when can you go back to work? The CDC states you can go back to your normal activities when your symptoms are getting better overall and you have not had a fever in the last 24 hours. However, if you do go back to work, NCDHHS and the CDC says you need to take precautions for the next 5 days to stop the spread, like wearing a mask, washing your hands regularly, and physical distancing.
It's also best to check with your employer to see if they have different guidelines. And keep in mind, the CDC says you can still spread the virus even if you are feeling better. If you do develop a fever after you go back to normal activities, you should stay at home. With your Verify, I'm Megan Bragg.